Today, we're diving into the incredible, high-stakes science of feeding the most vulnerable patients you can imagine, babies born months before they were due. We're talking about a world of microcalculations, where literally every single drop, every calorie, can be the difference between survival and something else. I mean, really think about that question. How do you do it? In neonatal intensive care units, or NICUs, this is the challenge they face every single day. When a baby is this tiny, their digestive system just isn't ready for the outside world yet. So how do you give them the fuel they desperately need to grow? Well, let's get into it. First things first, we need to get the language right. In this field, the terminology is incredibly precise, and for good reason. The care has to be even more so. So right off the bat, we have the preterm infant. Pretty straightforward. It's any baby born before the 37th week of pregnancy. Since a full-term pregnancy is around 40 weeks, you can see these infants have missed out on some absolutely crucial development time. But age is only one part of the story. Weight is just as critical. We have very low birth weight, or VLBW, for babies under 1,500 grams. That's about 3.3 pounds. And then, even smaller, there's extremely low birth weight, ELBW, for those under 1,000 grams, or just 2.2 pounds. These aren't just labels. These classifications literally determine the entire nutritional game plan. So, when a baby is just too fragile, too underdeveloped to even take milk, where do you possibly begin? You start with a direct lifeline. It's called parenteral nutrition. And honestly, the best way to think of it is like a direct fuel line for an engine that isn't quite ready to process crude oil yet. Instead of making the gut do all the hard work of breaking down food, a super precisely mixed cocktail of nutrients goes straight into the bloodstream through an IV. To make this all feel a bit more real, let's follow a case study. We're going to imagine our patient is a very low birth weight infant who weighs 1,300 grams. We'll use this little one's case to see how all the math actually works. The level of precision here is just mind-blowing. Let's take glucose, right? The main source of energy. For our 1,300-gram baby, the team figures out exactly how much fluid they need, the right glucose concentration, and after a few calculations, they land on a glucose infusion rate of 10.4 milligrams per kilogram of body weight per minute. That's the exact amount of fuel being delivered nonstop every single minute of the day. And this plan is completely tailored. It's not one size fits all. Protein, for instance, starts low and is ramped up gradually. Our 1,300-gram baby is aiming for about 3.5 to 4 grams per kilogram each day. But for a much smaller, extremely low birth weight infant, that goal might be as high as 4.5 grams to fuel that critical growth. And where do these numbers come from? Well, they're not just guesswork. They're based on very well-established clinical guidelines for amino acids, which are the building blocks of protein. The medical team starts with a safe amount and then carefully, cautiously increases it as the baby shows they can handle more. Of course, it's not just about glucose and protein. Lipids, fats, are absolutely vital for brain development. They're introduced slowly, and doctors keep a close eye on blood fat levels to make sure everything's okay. Fluids are also managed with incredible care, starting around 105 milliliters per kilogram and bumping up daily, with little adjustments for things like radiant warmers that can cause the baby to lose extra water. Now, that IV lifeline is an amazing bridge, but it's always meant to be temporary. The real goal, the big prize, is to get the baby's own digestive system up and running. And that brings us to the next huge milestone. So here's something that might surprise you. Feeding through the gut, what's called enteral feeding, actually requires more energy. And you might ask, why is that? Well, with IV nutrition, there's zero energy loss to digestion and absorption. The fuel just goes straight to work. But when the gut has to do its job, you have to give the baby extra calories just to cover the effort of digestion. So why make the switch then? Because enteral feeding, even if it's just a few drops of milk, does so much more than just provide calories. It's like a wake-up call for the entire gastrointestinal system. It helps develop enzymes, gets bile flowing, and basically teaches the intestines how to move. For our 1,300-gram patient, this is the very first step towards a lifetime of eating on their own. All right, so once the gut is awake and handling milk, a whole new challenge starts. How to provide enough fuel for the massive job of catch-up growth. This is where we have to start supercharging the milk. We all know breast milk is basically liquid gold. It's packed with antibodies, growth factors. It's the best nutrition out there for a baby. But for a preemie, with these extreme nutritional demands, you have to ask the question, is it enough all by itself? And the answer is not quite. While it provides all those amazing immune benefits that are so critical, standard breast milk just doesn't have the sheer density of protein and minerals, like calcium and phosphorus, that a preterm infant needs to build bone and muscle at that crazy accelerated rate. So, what do? They fortify it. A really common way to do this, especially as babies like our little patient get ready to finally go home, is to add a specific amount of formula powder right into the breast milk. You can see here how it boosts the caloric density from the standard 20 calories per ounce way up to 24, 27, or even 30. It's all about packing more nutrition into every single drop. You could almost think of these fortifiers and special formulas as protein powder for the world's smallest athletes. They are just loaded with extra protein, crucial minerals like calcium and phosphorus for bone growth, and even special kinds of fats called MCTs that are way easier for an immature gut to absorb. You know, getting out of the NICU is a monumental achievement for the baby and the family. But that nutritional journey, it absolutely does not end at the hospital door. The support has to continue at home. And this is where something called transitional formula often comes into play. These are kind of a step down from those super high-density formulas from the hospital, but they're still a step up from standard infant formula. At 22 calories per ounce, they give that extra nutritional boost that so many preemies need for the first few months at home. And the whole point of all of this, the IV, the fortification, the special formulas, it's all driving toward one critical goal: catch-up growth. It's exactly what it sounds like, the accelerated growth an infant needs to correct that early deficit and get back onto the growth curve they were always destined to be on. And just to understand what a monumental task this is, look at this. A typical, healthy 6-month-old needs about 100 kilocalories for every kilogram of their weight each day. But an infant in catch-up mode, they might need close to 180. That's an almost 80% increase in their energy needs. It is a massive metabolic challenge. This incredible, precise, and delicate science is what gives the tiniest of humans a real fighting chance to survive. But it does more than that. It lays the nutritional foundation for their entire future. The journey from an IV drip to a bottle at home is just this marathon of meticulous care. And it's all designed to answer not just how these babies can survive, but how they can go on to truly and fully thrive.